Welcome to this presentation on OR setup and medications, which is part of a series of videos on free flaps for OR staff. In this presentation, I will review some key components of OR setup and a few common medications used during free flap surgery. Although surgical loops are used in some cases, the majority of free flap microsurgery cases are performed using an operating microscope. Some of the most commonly used operating microscopes include Mitaka, Zeiss Bintero, and Kenevo. Microscope setup varies by model, but these microscopes usually have two heads and a sterile drape. The position of the OR table can vary depending on the type of free flap. The decision on OR table positioning usually takes into account ease of microscope positioning for the anatomical area where the free flap will go. For lower extremity free flaps, the OR table usually remains in the normal position with the head of the bed toward the anesthesia machine. For head and neck free flaps, the OR table is typically turned 180 degrees with the foot of the bed toward the anesthesia machine. For breast free flaps, the OR table position is surgeon dependent. It may be either in the normal position with the head toward the anesthesia machine or positioned with the foot of the bed toward the anesthesia machine. You will want to set up a separate Mayo stand for microvascular instruments. Some instruments commonly kept on the microsurgery Mayo stand include neuropathy sponges, Wexel sponges, microsurgery backgrounds, Castroviejo needle driver, microsurgery suture scissors, microdissecting scissors, microvascular clamps, McCabe dissector, vascular clips, vessel dilator, Jeweler forceps, and micro DeBakey forceps. The microsurgical vessel background is a flexible silicone background with 1 mm squares. These provide a high contrast background that assists in isolating and visualizing microvessels during microvascular anastomosis. Vessel loops should be available and are commonly used to label and retract vessels during free flap dissection. Microvascular clamps, including Acklin clamps, are used for free flap microvascular anastomosis. Acklin clamps are applied to microvessels, while double Acklin clamps are used to aid in performing the anastomosis. These are passed with an Acklin clamp applier. Vascular clamps, including DeBakey, Satinsky, and Bulldog clamps, may also be used when preparing larger source blood vessels for microvascular anastomosis. Lone Star retractor stays, commonly called fish hooks, and Lone Star rakes are commonly used during microsurgery dissection in order to provide constant, self-retained retraction. During the microvascular anastomosis portion of the procedure, it's important to have a source of suction that doesn't risk injuring the vessels or obstructing the field. A 5 French neonatal feeding tube should be prepared on the back table. This may be attached to suction tubing to provide constant suction within the microsurgery field. A variety of sutures are used for different microsurgery applications. Some commonly used suture sizes are 8/0 and 9/0 nylon sutures are commonly used for free flap blood vessel anastomosis. 9/0 and 10/0 nylon are commonly used in free flap nerve repair. 11 and 12/0 nylon sutures are commonly used for lymphatic surgery and supramicrosurgery. During the case, you may be asked to note and record dimensions and times, such as free flap ischemia time. This helps in maintaining an accurate record and in improving efficiency in the future. Now, let's talk about some medications commonly used in free flap surgeries that are kept on the operating field. Heparin is a medication used to prevent the formation of blood clots. Heparinized irrigation solution is used to irrigate the microsurgery field and lumen of blood vessels in preparation for microvascular anastomosis. This heparinized irrigation solution can be made by diluting 25,000 units of heparin into 250 milliliters of lactated Ringer's solution to give a final concentration of 100 units per milliliter. Next, you should assemble a 10 cc syringe and a 24 gauge angiocath to be used for irrigation with this heparinized irrigation solution. Papaverin is a phosphodiesterase inhibitor medication that relaxes vascular smooth muscle cells. This may be used to treat or prevent vessel spasm. Papaverin is typically diluted to a concentration varying from 0.5 to 3.0 milligrams per milliliter with normal saline. This may be applied topically or injected into free flap blood vessel lumens. In order to prepare the papaverin, ask your surgeon for their desired concentration. Next, you'll want to assemble a 1 cc syringe and a 24 gauge angiocath to be used for irrigation with this papaverin. No epinephrine containing solutions should be on the operative field for free flap cases, as these can cause problems with free flap blood flow. Thank you for watching this presentation on free flap OR setup and medications. Please stay tuned and follow for more presentations and videos on free flaps for OR staff.